Now that we've finished the cranial nerve assessment, we're going to go ahead and finish out the assessment by doing a quick assessment of the patient's face, eyes, ears, nose, mouth, as well as a quick palpitation of the lymph nodes and thyroid to see if we yield any abnormal findings. So I'm going to go ahead and start here on your collarbone at your supraclavicular thyroid. Do you feel any tenderness or swelling?
No.
Okay. Any pain?
No.
Perfect. I'm going to move up here by your ears to your preauricular. How about now?
No.
Okay, and I also do not palpate any swelling. I'm going to move to the back of your ears, the posterior auricular. Any tenderness?
No.
Wonderful. And what about right below it, the jugular digastric lymph node?
No.
No. Perfect. We're going to move back to the occipital. How does that feel? Any tenderness or pain?
Nope.
Beautiful. If you lift your head slightly for me. We're going to move down here. Most people will understand and recognize this lymph node. This is the submandibular. Any tenderness?
Nope.
Okay. And what about in the front of the submental?
No.
Beautiful. If you turn your head slightly, I'm going to gently palpate your superficial clavicle, cervical. Any tenderness?
Nope.
Okay. And what about in the posterior cervical lymph node?
Nope.
I also do not feel anything out of the ordinary. Last but not least, I'm going to gently palpate the deep cervical chain, the series of lymph nodes. Any tenderness?
Nope.
Perfect. I'm also not able to palpate anything. I'm going to gently, you can lower your head just a little bit. I'm going to gently palpate your thyroid region as well. Do you feel any tenderness?
Nope.
I don't feel any abnormal swelling of the thyroid. Okay. We're going to move now to your sinuses in your face. I'm going to gently palpate your frontal sinus region. Any tenderness?
No.
Okay. And what about maxillary?
No.
Perfect. As I'm palpating the patient's sinuses, I'm also checking the forehead and cheek structure to see if there's any protrusions, and there doesn't appear to be. The patient's head and shape seems neurocephalic and symmetrical to his body size and proportion. Go ahead and open your mouth for me and close. Okay. His jaw seems to open without clicking. We're going to go ahead and move to your ears. I'm going to gently palpate your pinea or outer ear. Any tenderness?
Nope.
Okay. The ears seem symmetrical. There's no apparent discoloration or extreme redness. They seem normally flexible, which is what we would expect of this type of tissue, no keloid development. If I had the correct tools, I would be able to see the cone of light at 5 o'clock on the right side and 7 o'clock on the left side. But we're going to skip that for today. Moving to his eyes. Your eyes seem symmetrical. Irises are green. I'm going to just shine the light just past your eyes to see if your pupils appropriately dilate. Good. And the pupils respond as I would expect. I'm going to gently pull down your lower lid to look at your conjunctiva. The conjunctiva are mostly white, a little red, but sleep deprivation will probably do that to you. But I don't see any instances of jaundice or broken blood vessels. The tear ducts don't seem to be occluded or inflamed at all, and the lacrimal apparatus doesn't seem to have any swelling. Any pain here?
Nope.
Perfect. Eyebrows are also symmetrical and full, as are the eyelashes. The nose seems symmetrical and ends at the appropriate location underneath the eyes. It's proportional to your face. We're going to move to the mouth if that's okay. Okay. The skin around the lips seem a little dry, but that is typical in this season with winter being super dry. Go ahead and open your mouth. Smile wide. The teeth seem intact, as do the gum region. They don't seem to have any infection. Go ahead and say ah.
Ah.
Perfect. The inner membranes also seem healthy with no discoloration. Stick out your tongue for me. Perfect. Go ahead and say light, bright, dynamite.
Light, bright, dynamite.
Awesome. I was just doing an extra check there to check your hypoglossal cranial nerve, all intact. All right, you seem to be in good health, sir. Thank you.